As I mentioned, we've set the stage yesterday with a conversation that looked at how the good life and health come together. Healthcare is one of the instruments for that, and not just in the medical dimension of it, but we've talked about information, we've talked about access to information, accurate information, we've talked a little bit about what new science brings to the table and how is that made affordable or accessible through technology, but also the rising cost of some of these scientific breakthroughs that are making our life or our daily life, but also our daily suffering, more manageable. The real problem is that through the development of medical sciences and the technology that backs it, we came to the point where we've said, this is what we can do. This is it. There's no way we can change this. That's the limit. That's the biological limit, the technological limit. We understand what's going on, but there's nothing we can do. We understand the mechanics of it, or the physiology of it, or the biology of it when you have no solution. Today, however, we are actually pushing physical communication, technological, and skill levels beyond those boundaries. And the three speakers on stage today are three different elements of that puzzle that are not taking no for an answer. And they push in their specific set of skills or sector the boundaries in those sectors. And they're not just pushing it elsewhere, but they're doing it in Romania, which in a context of the Aspen Ideas conversation leaves us also with a question about what does that mean for those specific sectors? What are the conditions under which they operate? What are the conditions under which they could do this better for more people, more accessible, and somehow contribute not just nationally but globally? And with that, I'm going to be very Eastern European and give ladies what is due to ladies. I'm going to invite Flavia, who's a specialist in embryology and genetics. And with that, the floor is yours.
Okay, thank you very much, Andrei. First of all, I'm very honored being here. I try to treat infertility. This is the main field where I'm working. And it's difficult, for sure, in Romania because of the lack of information, because the patient don't realize what they are exposed during life, and that the biological age is here, and unfortunately every one of us has to deal with it. And I'm one of the few of my colleagues who remain in Romania because a lot of them went abroad and they practiced their work over there. But I do believe that there is hope in Romania. And even though it's much more difficult than in the other countries, we can still do our job here, and with a little bit of, I don't know, persistence and hope, everything can be possible. But it's a lot of work. And you have to, I don't know, first of all, to informate the society, because infertility affects 1 in 4 couples at a reproductive age. And even though the myth says that, well, you know, the woman has the biggest problems in the last years, the masculine infertility is more than 40% involved in this issue. And even though we want to believe that we are still young and the future is in front of us, we have to think about the demography of our country, and it's a big problem.
So what he's saying is that the lack of information out there impacts the way we work. But also, you have the, in a sense, the luxury to work in a private institution that to some degree specializes in this, and you have a pool of affluent, relatively well-educated public that may access those services. How do you see that for the rest of the medical system? Like, is it a desert? Is it as bad as we think it is, or actually there's
I'm sad to say, but the medical sector is with a lot of problems nowadays, but there is excellence. They are very nice people and very well trained, and they are trying to fight the system. And here in Romania, things can be done proper for the patients, because at the end, the patient is the most important factor in our field.
Victor Costache, you're doing high-end, top-notch surgery in a field that is life-changing in a sense that life-saving. The same way as Flavia does, you mainly work and manage a private institution. Do you see that as part of the future for Romanian healthcare, or you see that as a test case that can be replicated also by public institutions? Where do you see that, and where do you see the specific niche for cardiac and high-end surgery in general?
First of all, I would like to thank you for the invitation. It's a privilege to be here with you, and I would like to thank the audience and to part of our team from Polisano who is here, and our general manager, Celestine Constantin. Your question is excellent, and it's in the trend of the day. You know, in a couple of weeks, we are organizing in Bucharest international conference of advocacy, because, you know, lobbying is forbidden in Romania, so it's an advocacy conference on cardiovascular disease. So why we are organizing this conference? You know, a few months ago I was elected president of the Cardiovascular Commission in the Ministry of Health with all these changes, and we have a very big problem in Romania. Romania is, I mean, everybody talks about all this false crisis in the health system with the detergents, with you know, corruption. The biggest problem which is confronted to Flavia and to myself and to many doctors is that the basic fundamental of the health law in Romania is not respected. So the money is not following the patient like it is written in the health law number 95. Okay, so the money goes like into thin air because there is a lot of money in the health system, but it goes, you know, where it shouldn't go. So this awareness conference is bringing up together people from all over Western Europe, but also people from countries like Bulgaria and Republic of Moldavia, to show that in all this country, in cardiovascular terms, things are going much better in Romania. Actually, Romania right now has the highest mortality of cardiovascular disease in the whole civilized world. So in Europe and whole civilized world, 58% of Romanians die of cardiovascular disease. If you compare to all cancers together, only 20% of Romanian dies of all cause of cancers altogether. So we have, it's like a massacre going on in Romania on cardiovascular disease. And we have all our population which is declining. I think we're up to 18 or 19 millions, starting from 24 millions in 1989. And actually Romania is the only country in Europe who has a continuous decreasing life expectancy starting from the 70s, it's still decreasing, despite all modern progresses of medicine, and it's the only country in Europe doing that, and that is because of cardiovascular disease. And more of that. Last week there was a publication in Le Monde. It was a statistic, big statistic study, meta-analysis, and actually we are against number one. We have the highest number of preventive death in the whole Europe. So the answer to your question, is it private, is it public? I think right now in the health system, if we have to compare it so everybody understand, I mean, it's an easy comparison. If we compare the health system to the transportation network, so actually we don't have highways. So we are risking our lives on a day-to-day pattern, driving on crazy roads. Well, in the health system, we have highways, but we don't use them. So we have around 100 private brand new hospitals who are not financed. So if you go there, even if you have paid all your life Social Security, the money doesn't follow you. The money you have paid, you have worked hard for. So it's the only country in Europe where it's happening like this. So the problem, I mean, everybody tries to find new solution, and which is not very sensitive, because if you want to build a car, you are not going to do a brainstorming. Should we do a round wheel or should it be a square? Solutions are already existing. We live in Europe. We don't live in Syria or in Lebanon or in Africa. In Central Africa, I mean, because Northern Africa is much more developed in the health system than we are. So we live in Europe, so we should behave like Europeans do. All these solutions exist, we just have to copy them. It's very simple.
I'll come back to that question in a bit, and I promise you that I'm going to get technical into it. Andras, your sector also is pushing the limits in a sense of helping people move in ways that medical science or where current medical science can't help them. So your approach to it is in a sense one driven by technology and computer science rather than purely medical science. What's the future for that in Romania? Are most of your partners abroad? I know you work for foreign clients, but how do you see that in the relatively, frankly, have to recognize that bleak picture that we've been offered yesterday and today on the options available?
First and foremost, allow me to thank you for inviting me here. It's an honor for me to be here. From the product point of view, the exoskeleton, our product, is an integrator, both vertically and horizontally. Because in order to have an exoskeleton, first you have to have all the sciences of nature, starting from mathematics up to physics. Then you have to have IT, both low-end, close to hardware, and also high-end, cloud, AI, all the buzzwords which are out there are things that we actually use. It has a medical component because this is a medical device. It helps people to stay healthier, emphasize on the and a financial part, because we do want to democratize access to this technology by enabling an affordable price, but we are not doing this for free. We are not a charity. We are a business. And there is also a social part, because especially in Romania, we are not accessible yet. Romania is not an accessible country from the point of view of the people with disabilities. And there is also a small part psychology, because actually for me as a manager, the hardest part was to interview people with disabilities, understand their suffering, but filtering it out and use only the relevant information for our business. And regarding the bleak outlook, I will say here this on stage, and probably some people think that I'm stupid, but I think that healthcare can, exporting healthcare services, not doctors, in 10 or 15 years can get us as much part of the GDP as IT software does. But of course, for that, we will have to do some radical changes.
Well, for now, the figures show that there are more Romanian medical graduates operating abroad or working abroad than there are in Romania. Certain specialties are particularly afflicted. Now, this was true for doctors. Now, increasingly, it's true also for very qualified nurses. And that becomes a systemic problem for both public and private sector. Now, indeed, the private sector, from the science to the purely medical side of it, is, if you want, a barrier to that, in a positive sense of the term. It does allow talented doctors and personnel and scientists and biologists and you name it to kind of keep working in the healthcare system in Romania and create maybe an opportunity for what Andras is saying. Well, let's reverse the logic and create systemic changes that allow Romania to become a destination for medical tourism, in a good sense of the term, really for medical services in a complex sense of the term. And my question to you is, you've mentioned that money doesn't follow the patient, that the system in Romania is not operating on an equal basis as the European one. And I'm going to ask the tough question in a social context. Romania is also I think it is the same issue of Le Monde showed a Gini index spread in EU 28. Romania is the most unequal country in the EU 28. That also conveys or translates in the healthcare sector. The question to you is, how can we ensure that by using public funding in private institutions, we're not further depriving the least, and I know the question is loaded and I'm using it on purpose, those that are least served or least, they have the least access to medical services?
It's not a tough question. I had the same conversation on Wednesday. I had a 3-hour conversation with Vlad Voiculescu, the new Ministry of an Aspen Fellow. He's such a great guy. And actually, it's the second time when I've met him. So I met him like 10 days ago, 2 days after he was named as the health minister. And I saw him this week on Wednesday, and I'm seeing him next week. So actually, it was one of the questions that was, intriguing him. Actually, this is not public money. So this is not money coming from, I don't know, the Ministry of the Defense Ministry. This is money that you have paid.
Yes, but I've paid in a social program.
So this
which
is
makes
money.
It a collective solidarity instrument.
If you want to know the whole story, it became public money during Nastase's reign when he was prime minister, when he, renamed all this funding, and he found a Secretary of State in the Ministry of Health who signed this paper, and it became public money. Actually, it's not public money. It's private money that you pay every month to get proper health care.
But I don't pay
what you pay for.
Well, let me push you,
Okay.
and I do it for the sake of conversation as much as I do it because I do care about the issue. The reason what I'm paying is I'm not paying for my healthcare. I'm paying for healthcare, period, for everybody's healthcare. Exactly. That's the logic of a contributive system. The question is, and that's why I think it's tough, because I don't have the answer, is how do you make that operate not just in the best interest of everybody, but in my interest as well as contributor? And I don't know the answer to that.
It is very simple. It's called the Bismarckian system. It was invented by Bismarck at the end of the 19th century, and it works in Germany, in France, in Holland, in Austria, wherever you want. It works. So you have private and public institutions work together under the same criteria. If you do two kinds of law, like we have right here, you'll have discrepancy. And what do you see every day? You see guys from the public institution getting arrested for stealing health money, you know, going to prison. So this has stopped. You have to finance the case, not the institution. So financing correctly the case is the answer. And I'll give you another example. Do you know the first private cardiovascular center in France was founded in Villeurbanne, which is near Lyon, by a communist mayor, a personal friend of François Mitterrand. And the first public-private, when they brought private surgeons into the public hospital, was founded in 2010. I was one of the co-founders in Annecy by extreme right mayor, you know, because people, when you talk about healthcare in a civilized country, they don't care if they're right or left or blue or red. They just care about people. So you have that all this money has to go to the patient. Okay, following European laws, not to some kind of detergents or some crap infirm software you don't need in a hospital. Okay.
Yesterday we've heard a little bit about how money should finance also education in order for having a better informed patients that actually reach hospitals sooner when the cost of offering them medical care is lower, the disease more manageable, the social cost of their debilitating conditions lower, and et cetera, et cetera. Now, for the two of you, my question is, if you were to choose the one element that would make your not just your daily life, your daily work, but really the way you see your sector developing better in 10 years now, what would be the one thing, the quickest thing that you've changed, if you'd have that power, to say, okay, I want to change this because in 10 years that's going to have the biggest impact on my field?
Medical education, for sure. In college, we have to teach the young generation from washing their hands. It's a true problem in Romania of using toothpaste and everything about having a healthy life. In 10 years, it could improve unimaginable. So I think education.
In general, how about your specific field?
In my specific field, I also think about the education during college and informing the young person about sexual life, about diseases transmitted by sexual activity, and all the things that are impacting on the fertility. Because even though it's just, I don't know, a taboo subject, you get, I don't know, syphilis or anything, but they don't understand the impact on their health, on all the health, and also the fertility part. So I think that education and understanding what is happening with your body during life and year by year is the most important thing. Because, okay, you can take the decision to delay the moment of having a child, but you have to be informed. Because many women and couples come around, I don't know, 30, 35 years, and they say, okay, I want to have a baby. And we say, okay, let's see if it's still possible. And there are some cases when we have to say, you know, it's not possible anymore. And they say, why? I never knew that this could happen. So informed patient is the key. to improve this problem, from my point of view.
I'll come back with a follow-up question. Andras, what's the one thing you'll change?
Well, this is a biggie because we are not a service provider, or at least that's not our core business yet. It will be in some time, but right now our focus is to have the product on the market. What I would change, this is a hard one because first and foremost, we are fighting an uphill battle against the multinational corporations in Romania for talent. And the pool is small because
the same way that hospitals fight an uphill battle with
exactly.
the doctors leaving.
Exactly. So that's one problem. Talent is a problem, but also if there would be a well-developed government grant scheme for innovation, that would be really good, because this is one of the questions I got from all the foreign partners. I contacted that. How much funding did you get from the government or the army or the Ministry of Health? And we said like zero.
Well, that takes us back to the question of the role of Minister of Finance, and maybe it's not a bad thing that the current Minister of Health has worked in the Ministry of Finance, at least for a few months. But it does tie into that. And the role of private investors, which in Romania have set the course, and in some cases, though this is, I know, a very touchy subject when you talk to the medical establishment in Romania, private institutions are pushing the boundaries. They are doing stuff that is not done in other institutions in Romania, both in terms of the quality of the service, but really in terms of bringing on the market cutting-edge new stuff. How hard is that, and why is it worth it?
Well, actually, technically it's tough. It's tough because you are not financed. So you have to live with the everyday reality of treating patients that, I mean, you can't treat all the patients that deserve to be treated, which is incredible for a guy like me who spent 14 years in France. So I was back in Romania 2 years ago. So I'm trying to push things forward. So it's very easy. It's very difficult to accept that I'm treating only a part of my patients, and this is one of my day-to-day fight to get normal financing like in Europe for every day. Actually, if you in cardiovascular medicine, you can see if you're reading the media that there are a lot of new stuff going on, and 90% of it was implemented by private hospitals in Bucharest, in ESHRE, in Sibiu. Actually, I have just received an email, a congratulation email from the president of the International Society. It's I will forward it to you after this session, where our work was elected, and it's just published as cover in the Journal of Vascular Surgery during the main conference in Washington. And we have the secretary of the American Society, who was in Sibiu 2 weeks ago. We operated together, who has presented our results to the entire audience. So we can do great stuff, but we want to do it for everybody. Okay, so this is our struggle, and I think with the current setting in the Ministry of Health, we are close in implementing this European normality to Romania. And we go back to one of your questions that we haven't answered. Actually, because of this reality, more than 20,000 young doctors have fled Romania since 2008.
Yes.
And bigger number of nurses, nobody knows the number. So actually we have a huge human resource outside Romania, okay, and we should use it.
Flavia, is there anything that science can do in your field that cannot be done in Romania today?
For sure.
Okay. Tell us a little bit, because I think we need to geek out on this session as well, and that's valid for all three of you. Let's get into the in really in layman's terms, but help the audience understand what's out there and what's pushing your domains.
Okay. Out there are many things which can be done in Romania if we have the money, even though they are from private or public resource, it doesn't count. But out there the things are moving for sure. I had the opportunity to go to London last year and to learn and work with the guys who cloned dolly sheep. And in the genetics, they are doing genetic engineering on any kind of animals. And for sure, they are cloning, I don't know, rabbits, horses, cows, and they are alive. So they also, in England, I think last year was born the first genetic disease-free baby, which means that the baby before, not the baby, the embryo, before it was transferred to the mother, was tested for all the known genetical diseases they have tests for. So that embryo, which now is a child, is believed to be a genetic disease-free baby. So things are moving. Here in Romania, the genetic field is at its beginning, but it's moving with baby steps. But I think, I don't know, in 10 or 15 years, we could do the things here in Romania that are done outside. Because last year we bring to Romania the PGS, the pre-implantation genetic screening. Mm-hmm. So we are trying to bring the news to Romanian patients.
I'm asking this because if I look at what Andras is doing and his company is doing, but also what surgeons are doing on a daily basis in Romania, I see a significant gap there. We have, the skill is there, the education is there, the experience, whether in Romania or the significant pool of Romanian doctors that have gathered experience abroad to really transform the domain and actually use stuff that comes from genetics into cardiovascular surgery. And I know we're pushing the limits not of just science, but also of ethics when we talk about this, but cloning tissue, which would be the transformative element in cardiovascular surgery in the future, allowing doctors to perform major miracles on top of what they're already doing in the field. But also with the support of digital technologies in getting the numbers, the artificial intelligence backing for genetic studies of that scale here in Romania. So while the ingredients are there, it doesn't seem to glue. We're not somehow operating, though individual sectors are there, it doesn't seem to form an ecosystem for medical science of that level. We've heard that in a prior panel on design. I'm asking you whether you see any hope for that happening in places like Sibiu, Cluj, or any other university center in Romania in a coming decade. Andras, let's start with you.
Allow me to just to give an answer to your previous question regarding Victor mentioned his daily fight for funding. In our case, we are funded privately by Romanian private investors. There aren't that many Romanian private investors, and there aren't, unfortunately, that many companies, Romanian companies, that were backed by Romanian private investors. So the message I'm trying to send here is that, yes, it is possible. There can be Romanian startups, and there is Romanian funding for that. One question. The other, from the technology point of view, exoskeleton as a concept is not necessarily new. The US Army has been doing tests in the 70s. The challenge with exoskeletons is to make them affordable, because right now, as we talked about the deficit in the health insurance system, especially in the public health insurance system, there is a need to make it affordable. So that's one of the driving reasons, the driving forces in our technology. Of course, there are more capable exoskeletons out there. If we are doing the Dacia Duster, other people are doing the Lamborghini, but the Lamborghini costs as much as a Lamborghini, or I mean more.
And you don't build hundreds of thousands of it.
Yes, exactly. That's for the 1%ers. We are trying to spread it, at least in Europe, in first.
Victor?
Yeah, it's a good point about this funding. Actually, for research, you can easily get private funding, or there are lots of for all these health problems, you can get funding from the European Union. Actually, we have two big grants, an educational grant, which is from the European Union. It's called, the program, it's called Saving Hearts. So we have medical students and junior doctors from France, Sweden, Ireland, and of course Romania coming to Sibiu in our institution, and they are trained for a few weeks in Sibiu in our institution by a team of one of the best European doctors. So we have even two American professors coming this year, Professor Sauer from Rochester and Professor White from UCLA. And the second grant we have also funded by the European Union. It's called Next Cardio. It's this time it's a research grant. So actually you can get this European money and private money into the health sector, but you can't have it for treating day-to-day patients, because for this you have the health system and the money from the National Insurance House. So I think we are in the health system into, if you have seen Ice Age, we are like the squirrel who is frozen into the ice. So we were frozen in 2012 when we had a reform of the health system, which was stupidly blocked by some people who were manipulated and protested against something they didn't understood. So the health reform stopped there, and nothing happens, and everybody is afraid to move it forward because, oh, you remember what happened in 2012. But I think people right now are not like they were manipulated in 2010, and they have tried to understand. They have started to learn. For example, if you're going to have a myocardial infarction here, you can have one, I can have one, okay? So instead of being treated in our institution in the European hospital, where you have a state-of-the-art institution who is one of the best intervention cardiologists in the country, you are going to be thrown in a helicopter, yes, because that's the protocol of the emergency medicine in Romania, and you are going to be flown a few hours away in Bucharest or in Târgu-Mureș because you're not allowed to be treated in a private hospital, which is completely idiot. And I think things like cost-wise, okay, and you see what happens with the helicopters, okay. So
I've already had a heart attack in your scenario, so I don't care about that. I'm kidding. But the point is absolutely valid, and the way I want to bring it back to the ecosystem of research is, you've mentioned the European Union funding. It's just a coincidence, and totally a coincidence, that the director for medical research, DG research at the European Commission, is a geneticist. And she's a Romanian geneticist that has spent 15 years doing cutting-edge genetic science in the US, in academic and private sector, private-funded institutions, and now she was headhunted by the European Commission to serve in that role, partly because there was a recognition in Brussels that they're not playing up to the American game when it comes to cutting-edge science research in the medical sector. So Ruxandra Draghiakli is, in that sense, a re-imported European. The same way for the ecosystem of policy changes necessary to create an ecosystem. We've heard that we need a change in a medical law, in the basic underpinnings of regulatory framework for health provision, and that, I suppose, includes elements related to what's the basic medical package, who gets what. They're moral choices. All these are moral choices. Also, whether you use public funding for exoskeletons or for fertility or for terminal care. 6% of Romanians have access to hospice care in a country that is getting increasingly older, and it's, as we've heard, more sick compared to the European average. So those things are moral decisions. You have to deal with that on a daily basis. How do you deal with it? How do you separate your personal, professional hat and that of a citizen that thinks in moral terms in terms of what would be just, what would be equitable, what would be a better common interest? How do you go about doing that?
Yeah, or Flavia.
Well, it's difficult for sure. Sometimes it's frustrating, as you said, that you cannot treat everyone who needs your help, but you have, well, I am doing this. I don't know if it's the right recipe. I'm trying to focus to the ones that I can help and to improve my skills on these patients, and from time to time, if it's possible, to try to help as many as I can. But admitting that you sometimes have limits, it's for sure extremely frustrating. Physical and financial and all kinds of limits, but you have to accept it.
Of course, on day-to-day practice is difficult because, for example, last week I had 2 kids and 1 adult dying on my waiting list because they had no money to pay their procedure, and one of the kids was my son's age. And secondly, what helps me surviving this is that I know the numbers, and I know that we live in Europe, and I know things must change because Europe will never accept this situation to keep for forever. And the numbers are very simple. We are 19 million in Romania. Do you agree? So we should operate 19,000 open heart surgeries every year because the patients are here. For 1 million, you have 1,000 procedures. Actually, there are only 4,000 cases financed and operated in Romania in public institutions. We are a few private hospitals who have cutting-edge technology, very good doctors. You know, there are 2 in Bucharest, 1 in Brasov, and ours, and maybe another one will open in Cluj. So if we receive full funding, we can maybe operate 3,000 or 4,000 more cases, but there will be another 10,000 cases that should be treated by the Romanian House of Insurance who collect all this money, because they are there and dying every day. So on midterm, I have great expectation that at least for the existing physicians and for the patients that surround us, things are going to improve. You see what I mean? Because of the numbers.
Andras, when do you see your product on the market? And in that sense, do you see a pressure for that, or just a business pressure, but also, let's call it a moral pressure as well?
Both. first and foremost business pressure, because as I mentioned, we are not a charity, we are a private venture. But there is also the like a social calling of it, because statistically Romania has the highest number of not properly rehabilitated patients. And that's not necessarily because of the lack of the talent, because there is talent. We see it every day in Oradea at the rehabilitation center. The problem is the relatively small number of hospitals available, the small number of doctors, the long waiting lists. So I can concur with Victor on this issue.
Well, we don't want this to make. Our idea was this is going to be the most optimistic panel, looking at what is impossible and still it's being done. And I must say that knowing those on the stage, they are doing it on a daily basis. But I know it sounds gloomy, partly because the realities that you guys are facing on on daily basis are like that. The numbers don't lie. Questions from the audience, and be as provocative as you want. You scared everybody?
Can I make
Yeah, of course, go ahead.
A short remark? You were talking about the glue to keep the medical ecosystem together. I think it's a society responsibility to find ways to keep our doctors here. I think that we have to find a certain environment to bring back all these human resources that are abroad. I think all of them, not just the, I don't know, Ministry of Health or everyone has to think about new ways to bring these good doctors and prepared to come and work here and just to want to stay here. I don't know, reduce taxes or to stimulate them to come back. Because abroad, okay, they are well prepared, they are recognized for this, and they have, I don't know, a good environment to perform. Mm-hmm. So if we can reconstruct this environment, we can bring them back. This is what I think, and I also hope.
What we've heard in earlier panels and throughout the day yesterday kind of ties into what Victor was saying. You mentioned the protests that blocked the process of rethinking the legal framework in healthcare. Now, can we jiu-jitsu that in a way and say, look, and there was a lot of discussion on this stage yesterday about civic mind, about active citizenship, about communities getting organized, you name it. Also about communication and information about that. Is there a way, and again, I know I'm on shifting sand here, particularly asking doctors or practitioners, is there a way to create a civic action for, and I'm asking that on the background of major scandals that you say are ultimately marginal to the bigger picture or the bigger problem, but is there a way to kind of create active citizenship at societal level, as Flavia says, to address this?
Actually, that's why we are having this talk. And that's why we are going to have this conference, and because people should know what's happening. So I'm very sorry this panel wasn't very optimistic, but this panel was realistic, because everybody should know this reality, because people are intoxicated by no news, when there are simple things that can change our day-to-day life and save our lives, that can be done immediately. And what Flavia said was very right. So if you want to have, not all these doctors, they will never all come back home, but a few of them, if you want to have them home, they left because there was no normality. So if you are going to recreate European or civilized normality in Romania, they're going to stay here or they're going to come back, because nobody wants to leave his family and his friends and his environment. This was true maybe in the 90s, where everybody was unleashed because the door of the West were open. But right now, everybody wants to keep its environment. We are no different than Spaniards or Italians or Germans. So recreate normality by doing what guys in Europe are doing. And we have to recreate and reestablish the confidence of Romanian people in the health system. This link was broken, so we have to act before it's irremediably broken.
Andras?
What I wanted to add that this problem is that, yes, Victor said that they should be treated equally from the point of view of the insurer, but what I will also say to the other part, government health institutions should also be run like a corporation, because actually a minor ingredient, but there is for the fact that so many young doctors are leaving after graduation, is that even if there is a relative lack of doctors, if you go to Cluj or to Oradea or to Timișoara or to Bucharest, then you will have a lot of doctors, and the system is still inflexible, while private hospitals are only looking for people with real experience.
Mm-hmm. Yeah, let me answer to this. I mean, there are very simple things that can be done right now and that can affect the quality of life of our young doctors and keep them here. For example, do you know there is a law in Romania, is the law 1141, which was issued in 2007 by two liberal ministries, who said junior doctors and young residents can be trained in the following public institutions. Mm-hmm. So they can get training in, for example, the University Hospital in Cisnădie, for example, but, you know, I'm kidding, but they are not going to get trained, they are not going to be allowed to train in the hospital called Monza, which is private in Bucharest, where we have Professor Marco Diena operating every day, and American guys are in our hospital, and actually. So when, as the president of this commission, when I went to the Ministry of Health and I say, hey, this is not normal, I spoke to the human resources there, and I gave them two examples, two of my best students. One of them was chief of her promotion when she finished medical school and wanted to do cardiovascular training in Sibiu because economical reasons she couldn't afford, you know, to rent a flat in Bucharest or in Târgu Mureș or however. And I told her, the lady in the Ministry of Health, hey, if we don't update this stupid law, because since 2007 we have more than 100 brand new hospitals, private and also public, and you can't go there. You can go in Cisnădie, which was, you know, built 200 years ago, and it existed in 2007, but you can't go training in a new hospital. And she said, oh, you can't deny these young people the right to leave the country. You see, so they just push these two guys who left the country, actually, because they couldn't get proper training.
Well, that's probably true, but it doesn't mean that you shouldn't do something to keep them here.
Yeah, well, we are trying, for example, we're trying to update this law to get all these new centers in the training scheme, and if they are trained, for example, in private, you can pay them better, and you can keep them here.
Victor, what you're talking about there cuts through all the topics of discussion for these 3 days, because it doesn't address just the medical sector. It addresses the reality of a legal system that is entirely dependent on vested interests. And sometimes those vested interests aren't even necessarily corrupt. They're just vested interests. They're just very specific to a very limited community that sometimes sets the tone and plays the music, and then everybody else pays the price. I think it's about time to liberate some of those energies and try to address that.
These laws, I mean, it's not like, oh, it's a stupid law, someone forgot. I mean, we could change it, but we really can't change it because it's there. I mean, these laws are there, and they are very well thought to be there to keep monopoles.
Yes.
and to build small empires in Romania.
Sometimes personal
Yeah, you
empires.
have a Professor X who has like 200 residents. One is carrying, you know, his computer, his suitcase. Another one is, making coffee. Another one. So these guys are going to leave the country, and that's right. You have to break this because we are in Europe. We are not in Syria. Okay.
Fortunately. Well, talent is on stage, so do ask questions. There's a question there. I don't see you guys, so there's a question in the back. Let's start here.
I just wanted to add, for me, healthcare could be a competitive advantage for Romania. It should be in the top 5 priority lists. It's like IT. The medical doctors trained in Romania are well renowned all over the world, and some of them are here, and the charters should come here to get treated. For a fact, I know that one of the best cardiologists in Paris is a Romanian. You mentioned the chief in the EU Commission for your funding, and I know Flavia personally. And
Research,
and I know Flavia personally. I know that couples come from Europe also to get treated in Bucharest because they have the same private standards as anywhere in Europe, and they report the same things. So you get all this asset, and if I add like a synergy, all the balneoclimateric strategic advantage that, as Flavia mentioned, they are taught in medical school, that it's unique in Europe. They have all the chain to do that. So this should be actually in the very top list. Competitive prices also.
Let's take another question or comment. Somebody from the back there.
I'm worried. It's our general manager. Probably he's going to fire me.
Okay.
No, Victor, no.
I don't see them.
What I want to know is an answer to that question. Are the national health program a solution for our country?
Well, the national health program were created as an additional, as a parallel system to the DRG system, when the DRG system, which, so people understand, it's coding different illnesses in order to get reimbursement. And this system was designed by Australians, and who were the first in the world to follow ad literam the Australians? Well, the Romanians were. Well, actually, I was in France. I did all my training in France. And in France, in the middle of Europe, we didn't care about the DRG system. We just followed them to laugh, you know. So we had the French reimbursement system, which works very fine. So we're just looking at the DRG system. Well, in Romania, we followed it ad literam, and we tried to implement it. And we discovered what everybody else has discovered doesn't work. So all these programs were implemented to try to palliate this lack of consistency of the DRG system for some key issues in cardiovascular in healthcare. Well, it started from a good idea. Well, actually, the key issues are not very well defined, and they are more subject to influence and personal power. I mean, who is more powerful will design his own program of funding on his specialty. So this is why, for example, you find that all these cardiovascular diseases have only 3% of the entire budget of the national social security system.
Though they lead to a majority of disease and death.
Exactly. So you have to redesign how the money you invest in this National House of Social Security is reinvested. That's number one. So the programs which have the merit to exist have to be redefined and recalculated following the statistic and the reality, while we have to move forward to the European principle of reimbursing the case. In Europe, in France, or in Germany, or in Holland, you have, for example, it's called a unity of care. It's like a euro or a dollar. Okay. For example, for an appendicitis, you are going to receive 5 units. For valve replacement, you have 20 units, you know, and it's very simple. It works like this. So, but first of all, we have to redefine these programs, and then we have to go to the second step, you know, implement this. This is very simple, easily to, but you're going to break monopoles, rules. And another thing nobody is talking anymore, which is paramount, is implementing private health insurances. Okay?
Flavia?
I had a question for you. We all know that the DRG is not working, for sure. Why don't we get rid of it? So why it's still in place?
Because people who get to high places who could get rid of it are more concerned about tomorrow's elections, and we have elections every 6 months in Romania, so we'll never get rid of it.
This is why healthcare is not working.
Well, to give an institutional answer with my Aspen hat, not as a neutral moderator, is the reason we've not invited officials to Ideas is to be able to speak freely about these topics. But we do have, if you want, events and processes like our healthcare program, but also the Bucharest Forum Healthcare, which is specifically designed to bring these types of topics in a international setting, particularly having in mind the French experience in public policy management of healthcare to Romanian decision-maker audience, not just ministers and people in a national house or the ministry, but also the Romanian parliament and the committees in the parliament that are responsible ultimately to make these choices.
I know for the infertility law, they are working for years and nothing is done, have been done.
Well, they are working for years is a term, a delicate term. They are doing nothing, you know. When we arrived, me and my colleague in cardiology, when we became president of the commission, we discovered in the human resources they were working in, for example, you had young doctors who did some modules abroad, 6 months, 1 year. And in cardiology, there were around 60 young doctors, and in cardiovascular surgery, around 6. And in the human resources, they were working to, this guy couldn't get their specialty exam because the human resourcing was working on their file. Actually, their files were in a closet there, and nobody was doing nothing, you know. And these guys were waiting then, oh, someone is working on our file to get our specialty exam. I mean, we just took them, signed. I mean, the guy did 6 months in Germany, in Berlin. I mean, just say it's okay. I mean, it's easy, you know? So you had like 70 young doctors who were blocked in between, you know, doing nothing. After doing 12 years of school, 6 years of medical studies, and 6 years of residency, and they were like in between doing nothing because someone put their file in a closet. And that happens with a lot of problem in the health system. The files are in the closet. Nobody's working on it.
Well, there is no hope.
Andras, you have the final say on this panel. You don't have some of these problems, partly because, as you mentioned,
fortunately,
you're independent and you operate based on your own pool of talent and skill and people that you bring in. But you do have a problem of having your products recognized, offered the right label, so to speak.
Certification is the legal process, the CE mark, using the Medical Device Directive. We are actually doing that in Hungary for the simple reason that the only government office that had this right in Romania, well, it was withdrawn last year, and since we can speak freely, the infrastructure is horrible. Driving to Budapest is 2 hours from Oradea. Driving to Bucharest is, in a good case, 7.5 hours, but it can be 10.
Helicopters. Okay. So with that, I think we're concluding a very provocative panel. A lot of food for thought, good ideas, but also immense obstacles, from infrastructure to human infrastructure, human capital, talent, legal framework, vested interest, and whatnot was raised here. Yes, the situation is bleak, but I think that we're coming to a point in a conversation, and also social awareness, where conversations such as this can kind of reach a tipping point and actually push things in the right direction. So thank you very, very much to the panelists, and I've learned a lot. Thank you so much.
Thank you for your invitation.